Okay. Welcome to the Business of Allied Health, supported by CliniScribe. We have the Honourable James
Huh.
Schomburgk. Where I heard of James was actually before he probably even knew me, when one of my mates, Chris Jellis, was part of the Back in
Mm.
Motion Health Group, and James just got onboarded into the group, being this whiz guru guy that I kept hearing about. Chris used to speak really well of you. I don't know what Chris is doing now, but I think he runs a successful practice in Melbourne. Welcome, James.
Thanks, Barry. Yeah, that's a long way back. Yeah,
It is. I think it's been close to 20 years.
yeah, that's scary. Yeah, it is.
Scary. Yeah.
It was 19 years ago I joined Back in Motion.
Was it?
So yeah,
Okay. So I got the
yeah,
numbers right there.
yeah, you
Nice.
did. Yeah.
So yeah, tell us about your stories. So I'm going to go back a bit further because from how did you end up choosing physio back in high school? Were you into sport or
Oh,
what
well,
was it?
had my heart set on medicine, and then I went on a school excursion. I still remember it clearly. And I went to a school excursion to the hospital, local public hospital. And there was a patient with a drip with blood in it. And next minute, I had all these nurses around me. I was on the ground. I passed out, fainted, the sight of blood, and they were trying to wake me up. And I was about 12 at the time.
Oh wow.
And I still remember thinking, well, that's not going to make me a very good doctor, is it? Passing out at the sight of blood. And I got a bit despondent. And then fortuitously, I got quite badly injured playing cricket. I used to be an opening batsman. And back in those days, you were a wuss if you wore a helmet, and especially as an opening batsman. So I didn't. And I got a mouthful of ball, probably hitting at 130 to 140 Ks an hour. A beautiful bouncer that sort of kept on coming in and hit my teeth. Lost a lot of my teeth, hence why I got these nice unruly teeth, and injured my neck. Doctor sent me to a physio who happened to be, and this was a fortuitous nature, happened to be and is still one of the best physios in the world. That I didn't know. You're only a kid. I was 14 at this stage. I had no idea. But he was brilliant and I love what he did. And I thought, this is cool. I can help people without dealing with blood. And I was very involved with sports, like a lot of young physio, well, people that age were. So it married my love for sport with that, but it was more for my own experiences. So that's what got me into it. Luckily, I got the marks. It wasn't easy, as we all know. Got in, and here we are.
Nice, nice. And yeah, a lot of us physios are med rejects as well, if you have to know.
Yeah, I could have got into medicine. I got the marks to get in, and that was before UMAT. But I got talked out of it by a lot of my family who were doctors,
Oh wow.
who said, look, do you want to commit your whole lifestyle to being a doctor? But I'd already had this great exposure by a specialist physio called Peter Roberts, who treated me. And I thought, no, this is cool. Yeah. And look, so medicine, ironically, was my second and third choice.
Oh wow. That's a
Yeah,
new
not my
one.
first choice. Yeah,
That's a
yeah.
new
No, I
one.
was. No, I was. So I didn't have my heart set on medicine
Nice.
whatsoever. Yeah.
Oh, great. So how did you end up in private practice?
I was always my plan.
Right.
Always my plan from the moment, much like a lot of people who just had a sports exposure. I was stunned when we were doing cardio and neuro and peds. I didn't think that was part of physio when I started. And I did work in the public hospitals because there was a lot of pressure to do. But I knew very quickly that I wasn't suited for the public hospital system. It was very regimented, structured, stuff which I've always regaled against. It was very quickly I realized that my dream to work in private practice had to happen probably sooner than I planned. So I moved from the largest teaching hospital in Adelaide to working in private practice all about 18 months after I graduated.
Oh, and just for the younger listeners here, is it if they're adamant on private practice, had any kind of benefits in starting in the public system for you?
No, no. When I look back, I mean,
Yep,
I don't regret it. I loved it and I
yep,
learned a lot. I had
right,
some great friends. You make really good contacts,
yep.
quite seriously with a lot of orthopedic type people, which really helps you with your career. But do you need to? No, not at all.
Yeah,
I think,
that's
no, I don't think you have to. It gave me another year of maturity. I was only 21 when I graduated, 20 when I graduated, sorry, I was 20. So getting that extra year and a bit made a difference. And so it helped me. But I would do it again, but I would also not have regretted starting in private practice. I think if you find a really good practice which does really good mentoring and supports you as a new graduate, and your heart is set on MSK and sports or all the other areas of physio now, I think go for it. Don't go through the hospital because it doesn't really help you that much with your future work.
That's a great point because that's different to some of the.
Yeah, I certainly drummed in at all the universities, and
Yeah,
I don't know quite why.
you don't
And,
know
and
quite
here,
why. Interesting.
well, here's the
Yeah.
interesting thing too, is how few of these people can actually get jobs in the hospitals. So
Mm.
it's almost creates a, it makes people feel second class that they didn't get into the hospitals. But the reality is, there's so few of those positions available each year that it sets you up for failure because only a few people are going to get in. And what do the rest do? Oh, you take a lesser job in a private practice, which is not a lesser job, but it's almost how it sees. Oh, look, I'm doing this because I couldn't get into the hospitals, and it
Yeah,
should never have been that way.
yeah,
But there is a lot. There is that conversation quite a bit.
it's still happening actually.
Oh, 100%.
Like at most unis
Mm,
that I've heard of even
yeah,
today in
yeah, yeah.
2026.
And it makes people
Yeah,
feel like they've failed when because they didn't get in there, and they
it
suddenly,
does.
oh, I have to work in private practice because I don't have a
It's
choice.
yeah.
Yeah.
Anyway, so did you start your own practice first or did you join back in
God,
motion?
no. No, so yeah, I went from working on my own, sorry,
Uh-huh.
working for somebody, doing
Right.
my masters, coming back, working for somebody, and then realizing after the masters that working for somebody after my masters it was probably time for me to set up my own. So I set up my own and did that for started in yeah, when did I start my own? So I worked for 8 years in my own practices. I started from scratch, like all of us do. Built up two practices. One, I shouldn't have built the second one in hindsight for a bit longer, but the first one was quite successful by the time I joined back in motion, end of 2007. So for 8 years, I was started on my own, but by the end, I had 3 to 4 physios in each practice full time, and they were humming along, particularly the Campbelltown, the original practice. And it was the reason I joined was not because I needed to, in the sense of my practices were doing okay, doing more than okay. It was more because I met Jason Smith, who was the owner of Back in Motion, at a conference. We were speaking mutually. I was speaking about back pain. He was speaking about business and loved his presentation. He's a very charismatic speaker. And we just, as you do, we were a couple of Australians in a sea of non-Australians. And he said, I loved your presentation, James. And I said, I loved your presentation, Jason. And he told me and basically we hit it off and he said, look, I'm going national with my group. Would you be interested? And that's how it started off. And I joined full hog. I ran South Australia, was in charge of South Australia. It was the only state at that stage that he expanded to, and I was his second in charge. Basically, something had happened to him, which thankfully it didn't. But something happened that I would have had to take over the role. So that's it. I went in
Wow.
full. I went in full hog. Yeah,
Oh, nice. Yeah.
yeah,
I know Jason quite well.
yeah.
He'll be on this interview soon, but he's so
No,
busy traveling somewhere.
yeah.
I don't know where he is right now.
He's a busy man.
Yeah.
That's
So
for
just
sure.
back to the point, this is interesting because I've heard other practice owners trying to start their second clinic and then struggling and
Mm.
learning to pull back. What were your specific lessons there?
Oh, I think I got carried away with myself, a bit of naivety and maybe arrogance. Look, my first practice was doing well, but not amazing. And I had an opportunity to buy a second one. And in hindsight, I should have made my first one really bulletproof and much more viable before I embarked on a second one because you more than double the troubles. So yeah, I think I just did it 1 or 2 years too early, but that's been my personality from being
Yeah,
a kid.
fair enough.
I'm a risk taker and made lots of errors as a result. But look, in the end, the second practice, after it almost bankrupted me during the back
Wow.
and management times, and it did, and
Wow.
it
Yeah.
became my flagship and was one of the flagships of the entire group. It almost destroyed me, but it also was the most profitable and the most successful in the end. So, look, it was just probably a year too early. I guess my message to people is make sure if you've got a really good system, if you've got systems down pat, if you've got your structures down pat, you're highly profitable. Going into multiple practices is absolutely fantastic, but don't do it before you've ticked all those boxes. It's easy to think it's easy, but it's not. It's so much harder once you get the second one.
Interesting. And what helped you grow your first practice? What was the secrets there specifically?
Luck. This was
Luck.
before back in motion.
Nice.
Oh,
Yep.
look, I don't think that this is the thing, and
Yeah.
it was only in the last 2 years
Right.
before joining back in motion that I started thinking of it as a business. Before that, I just ran it as a practice where I just wanted to grow. I wanted people to work with me. I loved being in teams, team sports. And then I loved being involved. I liked just working with teams. And that was my dream from the outset was to have a team. But I had no idea what I was doing as a business person. And it showed. How it worked was I was known, I topped the year in the master's program. I was known for my clinical acumen, I think. And so as a result of that, I did attract people to come and work for me, but it was more from the training I gave them, the support I gave them without really any planning on that. That's probably what attracted people and helped me grow. But I learnt the hard way you've got to have good systems and structures, which I really only started happening in the 2 years prior to joining back in motion. That's when I really hit my straps and started being serious about being a business.
And what did that mean for you? Going
Oh,
from going from
it let me literally mean having proper contracts for so it was
yeah,
everything, Barry. I mean, I
basic
can't.
everything.
It was everything. Having good
Yeah.
systems, having structures, having procedures, policies, strategic plans. It literally was. I had none of that. I just literally worked day to day without anything, and we didn't have back in early 2005, a long time ago. There wasn't much in the way of stuff other than paper. You wouldn't have the internet where you could actually get this information from. Well, we've got so many great free resources now in groups and so on where you can learn so much without even getting a coach. And I never even thought about getting a business coach until well later. So there was so many things that I just did. I just, as I said, it was luck because I think sheer will and also just that I did provide really good education that I think got me through the early days. And then I realized, no, I've got to move on.
Yeah. So you said your parents were doctors.
And not my parents, no, my
No?
parents were,
Oh, no.
and a lot of cousins, a
A
lot of
lot of
cousins were.
cousins. Did they
Yeah.
run their own businesses and help you at all?
Oh, they did, but they were doctors are usually the worst business people.
Yeah. Okay.
But most of them were
Yeah.
just most of them worked on their own and just were receptionists, and that was it. So
Yeah.
yeah, they were specialists, not
Oh,
GPs.
specialists. Oh, fair enough.
Yeah,
Yep.
yeah.
Yeah. What's one key metric that you, if you did have a business now, you'd actually measure that is a good kind of health check or pulse check on the business?
For strategic reasons, and I think the most important is retention of staff. So I measured staff retention. I'm talking about clinical staff, not
Yeah.
support staff. I know that sounds simple, but the longer you hold on to good people, the easier it gets. That's as simple. A lot of the problems we have with our businesses are because we keep losing people as they just build up their database. And so for me, that was the most important one that I spent the most time on. And it's not just the number, it's how do you do that? The second one, I'll just give you a second one, which is easier and is more a day-to-day measure for me was what we called ESD, early self-discharge, which is cancellations, but it's cancellations where a client cancels not to rebook, not because one of the things I've learned from presenting a lot of papers on cancellations and presenting at conferences is everybody defines cancellations different. What I'm not talking about is somebody's cancelled today, what's on a Monday, and rebooking for Thursday or next Monday. That's not a cancellation in my mind. That's just a rebooking. So it's basically where you fail is when a client is dissatisfied with your care, expectations are unmet, you didn't build a therapeutic alliance. That's the stuff that matters the most to me. So that to me is the most important metric for day to day. But as I said, more strategically, it's retention of staff.
Just on that note, what about self-discharge when the patient says they're better? Is
Oh,
that
yeah. No, so if a client, yeah, it's a really good point. If a client says, like, for example, they ring up
yeah,
reception and say,
mm,
"Can you tell Barry that I feel
yeah,
so good? I don't need to come back again."
probably hear
That's
that a
a
lot.
that's a win.
That's a win. Okay,
That's
yep,
a, do you hear that a lot? Look, I think there's a paper by Andrew Thomas, which showed
nice.
probably about 10% of clients who cancel not to rebook are in that category. But don't kid yourself. That's what most people say. 90% of people cancel silently. They don't actually tell reception that they feel great, or they don't even tell them that you suck. To be honest, high performing individuals and high performing clinics, really, you get once every 3 months somebody saying, "Look, I feel really sore. I'm not happy. I'm going to see my doctor." That's so rare. What most people do is they've cancelled, they cancel and they go out silently with enough white noise and confusion that you don't know how to follow them up.
Yep.
They'll
And
say,
if you
they'll
try,
say,
if you can't, yeah,
yeah,
they'll
no,
ghost you.
they'll say, "I need to check my roster. I'll get
Yep,
back to you.
yep,
Something's cropped up." You can see there's the difference. And I always tell people when I train them in this, listen to the reasons. When they say, "Can you tell Barry I feel great?" That's not lying. People will only be that clear when they do feel great.
that's a great point.
And also, they will, if you try to ring those people or text those people, they'll respond. But the bulk of the clients who cancel, the bulk, 90% of your clients who cancel, have just made up their mind. You did nothing to upset them. You just didn't satisfy, you didn't give them what they're wanting. And you didn't build a therapeutic alliance. And so they thought, "I'm going somewhere else. I'm bailing. I'm in pain. I can't wait to get better. I need to be better now." And people do this regularly. And we often are ostriches thinking, "Oh, they will check their roster. They will get back to me."
It
And
never
again,
happens. Yeah.
it happens
Oh,
occasionally. It's
yeah,
occasional. Yeah, some people generally do check their
yeah.
rosters, but something's cropped up. You'll know that those people don't, and it's so hard to get those you to get
Okay.
them on the phone or to get them on text.
Is there any way of setting that expectation to increase the likelihood of them not ghosting you?
In what
Or
sense? So,
as in, oh, I'm going to check my diary, but really it's a dissatisfied patient, right?
yeah, yeah.
Is there anything you can do in that initial consult or whatever it was to set the expectations that you're going to follow up? Or is that going
Oh,
too far? Like,
I would never want to assume that I need to do that. So for me,
yeah,
it's about nipping it in the bud. Once the client's walked out of that room, and if you lost them, it's what you do in those four walls is your only true opportunity to rebook. Our own research, and it was a 26,000 patient sample, 0.1% of clients who were dissatisfied with our care returned for care. 0.1%. So if a client has walked out of that room and is dissatisfied with what you've done, not angry, just dissatisfied, they're not coming back. They've got so many choices. So you've only got being honest with yourself. You can make those calls. You can be a great salesman or saleswoman.
yep,
Most physios hate making those calls, follow-up calls
they
when
do.
somebody's, and because it's a really awkward conversation. The person on the other end doesn't want to hear you. You don't want to make them. Your only chance you do is to make a difference in the consult. The research shows exactly what we found in our own research. There's so many papers on this. Meet their expectations, get results, which is usually symptomatic relief early on. See them regularly, intensely, early on. And that's one of the biggest challenges of our profession. We undertreat horribly in the front end of our care. And secondly, ask great questions. So if a patient's dissatisfied, ask great open questions so you know before they leave the room whether their needs were met. That is when you've got a chance to rectify. Once they've left, most of them don't come back.
Very interesting insights there. Yeah. Hopefully most people can hear that one.
Yeah,
That
well, I think
that that's
it's
that's a big
important.
one.
It's just
Yeah.
kidding yourself if you think you can get those people back. Look, there are probably a few in the old DISC, the
Yeah.
behavioral profile. There's probably a couple of high D physios who don't mind confrontation, who are quite prepared to just keep ringing, texting until the person's that jacked off with them, or they will get on the phone or get on the text or the
Mm,
email. But most physios hate doing that because they feel like it's demeaning. And I understand that. I think the thing is, just ask great questions in during the consult. How do you feel you're going? Is a pretty important question, but it's pretty simple. How do you feel you're going with your neck? Leave clients that then are going to be forced to then answer it, and you pick up on that before they've already checked out. Because once they've left those four walls, it's so hard to do anything about it.
very interesting. All right, that's another conversation there. For
Yeah,
sure. So, just wrapping up, what's one lesson you've learned running a successful allied health clinic or training others
yeah.
that you haven't heard on social media? Maybe it's just not comfortable to see. It's the truth that you could share to others in this.
I think the uncomfortable truth for me, and look, whether or not we hear it or not, if I go to the thing that often creates the biggest division between employers and employees, clinicians, is PVA, patient visit average. If your model, and most physio practices models are based on, like ours was, optimal lifelong musculoskeletal health. That's what we created before I even joined Back in Motion. And Jason, to his credit, took over that moniker with my permission. But if that's what you stand for in your practice, and you've got to understand PVA should be reasonably high. And a lot of physios don't like talking about PVA, saying it's forcing people into consults they shouldn't have. It's
Mm.
so untrue. If you've got a PVA of under 4, you're probably not even helping them get out of pain most of the time. Most of us know it takes at least 4 to 5 visits to help get somebody at least out of pain in the acute stage. If you're averaging 2 or 3, they're leaving you early. You can hide your head in the sand and say, I don't like talking about PVA, it's unprofessional, it's salesy, but this is just a reality. If that's your average, there is something you're missing in the front end. Conversely, as I said, if you've got a model of optimal lifelong health and you've got a big gym, you've got like we did, we had gyms, we had Pilates studios, we took the patient through a journey. It should be an expectation that those clients that you're actually, because that's the clients we attracted and the clients we wanted, you should have a reasonably high PVA. You should be sitting well over eight. And if you're not, then you have to look at what is happening. We can pretend that PVA is a sales thing. It's actually a measure of the also a very strong reflection of the model you have. If your model is just to treat pain and then get somebody out, 4 or 5 is reasonable. But if your model's about long-term change, long-term difference, chronic pain particularly, then you're going to have a high PVA. And I
Right.
think we've got to stop being embarrassed about that. So I think the problem with KPIs is not the number, it's how employers who do it poorly use them because they see them, the bad ones, see them, the number, and that's all they look at. What you then got to look at is the why. And that's all I use my KPIs were for looking at where there were perhaps gaps in a clinician. And I say perhaps because not always. That's why then I would do a deep qualitative dive and look into their cases. I think it's how you use them. If you just use them as raw numbers, you are going to struggle. I think use them as a tool to look at what you're trying to aim and set them around that. And if somebody's at variance, then just do investigating with them. Be a human then. Don't just be a dictator in numbers. Then say, okay, let's see why they're struggling.
Good. And on that note, what do you think of treatment plans? Should they be used for every single initial consult?
Absolutely. Client want, patients want them. There are so many papers showing that patients want not just a verbal plan, a written plan. And you just put yourself in your client's shoes. If you're a client and you were seeing a doctor, you'd want to know what's ahead if you were having an ongoing treatment approach. If you were seeing a dentist, you would want to know what's going to be happening if I've got something going on with my teeth. We owe it to our patients not just to give them a treatment plan, but also the best treatment plan for that patient's care. And that comes back to I was talking about physios under treating. We've got to look at our own hang-ups because your client is expecting, your patient is expecting you to give them what is the best treatment plan for them. And often physios give their patients the second, third, or even fifth best treatment plan. And you have to ask yourself why. Why would you not offer? I, as a patient in healthcare, would want to be given the best treatment offered for my health problem. Why don't we, as physios, and then let the patient decide if they want that or something slightly less? We make assumptions that aren't valid. We try and second guess how much they can afford. They're not wanting that. They're wanting the best available treatment plan. Treatment plans are an absolute necessity, but don't go in. The biggest challenge I see with treatment plans is not so much now that I think they're getting delivered a lot more frequently.
They are.
But what's
Mhm.
not happening is people are often not getting the best available treatment plan offered. Surely that's what we should be offering every client, as I said, the best available treatment plan. And then the client decides. Patient, shared clinical decision making is that give the patient the best information so they can make a good decision. Don't offer them the third best if it's not, if, and they don't know it's the third best. But could you imagine if you said that? Can you imagine if you said, today I'm going to give you the fourth best option for your shoulder? Patients would be thinking, why'd you give me the best? What's wrong with me? Don't do it. Offer them the best and let them decide. If money's an issue, if time's an issue, they'll bring it up and then you work around that. But then they know that they have that you've offered them the optimal and they are choosing to have something slightly lesser.
Yeah. And this doesn't even have to happen in the first consult, correct?
No, it doesn't.
That's the
If
thing.
in back
Yeah.
in motion, we would present it. We'd always give them a verbal in
Yep.
the first couple of minutes. This is what we think's wrong. This is what we think you need to do. This is how long it's going to take. But sometimes it takes 2 or 3 sessions to get a real handle on a patient, particularly more complex cases. So that back in motion, we used to present our treatment plan formally on visit 3. It could be earlier, but by visit 3, because sometimes it does take that long. It depends on the condition.
Thanks for that. Thanks for your
That's all
time.
right.
That's a lot of insights there.
No worries, Barry. Thank you for having me.
It's a pleasure. It's great. Thanks for sharing all those genuine insights, and hopefully that will allow physios to think about what they're doing in private practice. How would they reach out to you, James? What's the best way if they want
uh,
you as a coach or
yeah,
to learn? I know you generously offer a lot of free content as well. Yeah.
yeah, we do. So first, thanks, Barry. First thing is if you're interested in joining our group and just for the free content on Facebook is where we're most active. It's the second visit. If you just put in the second visit. If you're wanting to make contact with us, Jeremy Hobbs and I are business partners in this. If you go to thesecondvisit.com.au, there's a lot there, including what workshops we run, how we run clinical mentoring, and how we run mentoring to improve performance of individual teams and individual clinicians. There's all there. And that's what we love doing. We've now got to the point now that I've sold my practices and I'm now had the fortune of being able to help broader by helping teams and individuals, more so teams, improve their outcomes with patients, which is great for practices because everybody wins when clinical outcomes are met and achieved more and more often.
Love it. Yeah, reach out to James. I think he is one of the biggest experts here, getting a good value in this interview as well. So thanks, James. Thanks for your time.
Thanks for inviting me.
All
Thanks,
right.
Barry.